Hi everybody, Rose Faith here, Model Tasha. Welcome to the Health and Wellness channel. Let's get started with the signs of stroke and heart attack. Like I promised, here it is. We use an acronym called Be Fast. B for balance, if the person used to walk normal and they're tripping all the time. Note, F for face. Ask the person to smile. Does the one side of their face droop? And then their arms, ask the person to raise both arms. If one side keep drifting, that is also one of the signs. And then the S stands for speech. Ask the person to repeat a simple sentence. Mama, tiptoe, like mommy is coming, mommy is making amazing food. Is their speech slurred? Difficult to understand? Are they talking differently than they normally talk? All of a sudden they're sounding differently? Yes. And then time is one of the critical essence. Like we say in the hospital, time equals brain. So if a person shows any of these symptoms, call 911 immediately. Eye movement, blurry vision, side weakness, numbness in the face, arm, leg, their eyes are blurry, they are complaining of their vision all of a sudden, they're suddenly confused or trouble speaking, you're having difficulty understanding your family member or friend, sudden trouble seeing on one side or both eyes, like I said, and then they're having, some can even tell you, those are like symptoms of the ischemic stroke, like I mentioned earlier. Others will tell you, I'm having the severe headache, like the worst headache of my life. And then sudden trouble walking, dizziness, loss of balance. So remember, be fast, balance, eye movement, face, speech, and time. Now let's go to heart attack. And please remember the stroke signs. Okay, heart attack, chest pain or discomfort, a feeling of pressure or tightness, pain, discomfort in the center of the chest that lasts for more than a few minutes. It's persistent, discomfort, tightness, or comes and goes away, then comes back. That is one symptom. The second symptom is shortness of breath. This patient is feeling like, I can't catch my breath. Feeling of like having shortness of breath even when they are resting, they're like, I can't catch my breath, kind of a situation. That is another symptom. So chest pain, shortness of breath, difficulty breathing, and pain, discomfort in other areas, discomfort in one or both arms, like their arm, like maybe the chest pain comes from the chest, goes to the arm or to the neck or the jaw. So here is a big difference between the male may experience the chest pain, but the women may also experience stomach pain, GERD, kind of a GERD reflux pain, cold sweats, symptoms like that. So breakout in sweats or for no apparent reason, lightheadedness or dizziness, they're feeling dizzy, fainty feeling all of a sudden, feeling of fatigue, feeling extremely tired or weak even after resting, like I'm always tired. And then they're having a rapid or irregular heartbeat all of a sudden. Remember the rapid, like heart palpitation, your heart is beating super fast, faster than usual, doesn't have a regular rhythm. That is all another sign. It's critical that we differentiate between the signs that men may have and women may have. The women may not have the chest pain. They may have, like I've said, the pain in the stomach, the feeling of like it's an ulcer or reflux, and then arm pain, stress, fatigue. It may be different, and sometimes you find that when it's too late for women to be diagnosed with a heart attack than men. Upper abdominal pain that may radiate to the back, nausea, vomiting, queasy, vomiting. Those symptoms may appear for women more than men and may be a classic heart attack sign, but may be considered as something else. So to my beloved women, let's take care, let's be more educated, let's go for those checkups most of the time, because we need to take care of our health. And stroke or a heart attack is a serious condition, and we need to know where we are with our health. So if a person, a friend, or a beloved, or somebody in the street experiences those signs and symptoms suddenly, call 911 and they'll direct you on what to do as they send help. Stay calm as the person who's responding to them, remain calm, and just follow every instructions that the other person on the line is advising you. If you have any questions about the stroke, about the heart attack, I'll post both photos on the side, like symptoms, the BFAST acronym with how it looks, and the heart attack for both women and men. They may get a classic sign or they may get different signs for women. So let's take care of our heart, guys, and let's take care of our health. And for stroke, brain equals time. When it comes to a stroke, where time, we have 4.5 hours for you to be treated for that stroke symptom to be reversed. So if you notice those symptoms, this is what to do. 4.5 hours, you call 911 or drive that person to the nearest emergency room. They will take them for imaging and do all the necessary stuff. So you have to put in mind, when you go to the hospital, we normally ask, when was the last well known? When did you see them? They were okay, then 1 minute they're not okay. Was it before they went to bed? And then this morning they woke up like that. That is really sad, because now we may be able to reverse some damage, but the next may not be able to be reversed, because we don't know for how long the symptoms started because they went to sleep. But if it's during the day and all of a sudden you started, this person was talking to you, okay, and then and then the symptoms, the BFAST acronym symptoms start appearing, and you're like, what is going on? Take them to the hospital. That's within, like, maybe it takes you an hour to get to the hospital. You have now 3.5 hours. Then they get to the hospital, they have to assess them, and then the doctor has to see them, assess them, then send them for imaging, maybe another 30 minutes. You have 2 hours, and then so use 3 hours. So you see, time is going by as you're getting ready to go to the hospital, as you're driving to the hospital, as you get to the hospital, get assessed, and everything is done in between. Time is running down, and all these, the drive to the hospital, the going to the CAT scan and differentiating, is it a brain bleed or is it a clot, it has to be done within the 4 hours. So guys, whenever you notice these symptoms, remember time. So of all the BFAST symptoms, the critical one is time. Time will save that person. And most of the time they'll say, I just feel tired, let me sleep it off. Do not let that person sleep it off, because they may sleep and never wake up. So remember, time will save that person's brain, and it will be able to save the damages that will cause from the stroke. It may be a brain bleed. Those are severe, less common, but severe and can kill within no time. But also stroke will cause some severe damages if not treated on time, where the person will never be the same again. Some symptoms will go, some will not. Interesting thing is, for both heart attack and stroke, time saves the brain, time saves the heart. Because when the person gets a heart attack, and maybe remember the blood vessels that we were talking about, they are clotted and they need to go to the cath lab. They need to be attended immediately. So what happens with a stroke? You have 4 hours. Guess what? With a heart attack, you have 90 minutes. That is 1 hour 30 minutes for all this, for you to get that procedure that will take care of that, with the clotting of the blood vessels that are damaged. So your heart is very critical. Maintain that blood pressure. Remember what we discussed about high blood pressure. Let's take care and manage our stress, manage everything, every stressor. If you have to go to a therapy or talk to a pastor or talk to a mentor, whoever you believe, whatever you believe in, please do it if it will save your heart, because it will save your brain and your heart and give you a better, healthier life. So both heart and brain, time is critical. Let's learn these symptoms. You may say it may not happen, but you never know. Just learn them. You may save a friend or a person on the street. So thank you. I just wanted to emphasize that, and let's be proactive with our health. Again, our health is a goal, not a destination. Thank you. Till next time. So stay tuned till next time. It's yours truly, Model Tasha, registered nurse, and stay healthy. Till next time. If you have any questions, leave them in the comments. If you have a topic or maybe something I missed with these topics that I have recently discussed, let me know and we will discuss them, okay? All right. Thank you guys. Till next time. Bye.